Every time I get a bit of a chest cough or something like that, you always think, is this going to be it?
But I was working at a mine where they had quite a few cases.
If you've got that lung disease, it impacts massively on your whole life, family, work, life in general.
Being diagnosed is not the end of the world. The importance is that it's been monitored. Previously, you've had high levels of dust exposure over a long period of time. Once you're diagnosed, it allows the community to put you into a level of low dust environment. And the companies, the government, the medical profession, the unions and the work cover people are working at that to make sure that you are working at a low level of dust environment and that you've got much more protection than you ever had in the past.
But I love this. I love working out here. I love what I do. It's an awesome place to be.
Yeah, I love it. Yeah, it's a great lifestyle.
It provides a good wage and a good life for my family.
I'm passionate about the process we do and how interesting it is. So I'd be thoroughly disappointed to have to, change careers at this stage in my life.
Medical surveillance is key in identifying disease when it's very, very early in the very first stages so that we can remove people from exposure or we can reduce exposures and prevent that disease from progressing. If people do get sick, we can't reverse the disease, but we can treat the symptoms. We can provide pulmonary rehabilitation, which means we can make sure that the rest of their body stays healthy and they can do much more with the lung function that they do have. It may mean that they have to be working in an area of the mine that has less dust exposure.
The Mine Dust Health Support Service is available to provide health for current and former workers with understanding the screening and diagnostic processes, their compensation rights and how to access ongoing support. This includes accessing free lung checks for retired and former workers.
I thought I was running out of breath and running out of energy and that sort of stuff. That was just normal, getting a bit older on that, but it turned out to be it wasn't, it was black lung. I've been looked after by everyone. I've had a lot of support from the hospital. They give me a free oxygen machine. It goes 24 hours a day. And I've also had to buy a portable machine. So I bought this one. And the compo paid me back for it. $5.5 grand for that.
Want to see my family? Be there all the time. I don't want any diseases catching up with me later in life, so I must try and protect myself in the meantime.
My health is number one for me.
I'm an outdoors kind of bloke, and if I was affected by silicosis, then it would devastate me.
I'm a young father, so I need to be able to be there for my family. I need to be able to be there for my workforce as well.